Why is language important in trauma-informed care? Over the years, we've found that language can be absolutely critical in delivering effective trauma-informed care. It can either make it effective or ineffective based on our ability to understand what a child understands. When we're speaking, firstly, we need to be mindful that some children will understand certain words and some children will have not a clue what we're talking about when we use those exact same words. It's very unique to each individual child. We as practitioners, as carers, as those supporting children need to be checking in to check their understanding and check that they've understood what we're actually saying. That's so important, and it's very different for each individual young person. Secondly, we need to be mindful of language triggers. Are there certain words that can trigger past trauma for a child or young person? If we know those words, we can either avoid them or we can support them through therapy or through trauma-informed care to be able to cope with those words in the future. Thirdly, we need to be mindful that each family has their own unique language. Very often, we'll make up words for the things that we come into contact with every day. And often our children think those things are called those made-up words. Fourthly, language is very much linked to our identity and who we are, and we need to be mindful of that when supporting children and supporting families. People can be very protective over their language because it does form part of their identity, so we need to be respectful of that. So there's just a few examples of why the spoken word is so important in our trauma-informed care and therapy interactions.